Transcriptions and Translation, Vicarious Trauma for Interpreters and Translators, which is the topic of her talk today, also Ethics for Interpreters and Translators, and Pedagogy of Translation and Interpreting. She has a long-term record of engagement with the translation industry and translation and interpreting industry, and is the current, as such, she is the current National Secretary of the Australian Institute of Interpreters and Translators. And she's going to talk about some of the advancements in Australia in relation to her topic of interest. Thank you very much for joining us today. Thank you everyone for joining us online as well and for coming here to join us on site. And the floor is yours. Thank you very much.
Thank you so much, Esther. Which way do I look?
That is the camera.
Okay, all right. Oh yeah, over there. Yes, all right. Hi everyone. Remotely, a very big thank you to Esther for inviting me to give this talk today. One of the topics that I'm passionate about, the vicarious trauma experienced by interpreters, and I'll talk about a little bit about how we become aware of it and the prevention and self-care. But the reason I'm in your beautiful country is because I'm on this Erasmus mobility visit hosted by wonderful Professor Anthony Pym. So thank you. Thanks so much, Professor, at the University of Rovira in Virgilia. I hope I pronounce it okay. Thank you so much, Anthony, for hosting me. All right, so for today's talk, normally I like to start the talk by sharing just a couple quotes to bring people's mind in the right place, if I could put it this way. So these are a couple quotes shared by my colleagues back home, which I'm really, really grateful for. So one colleague said that I felt physically sick when interpreting for an incest case in a police interview. Another colleague said that I stepped out of the police station after a long session of interpreting for a murder case. The person was still covered in the victim's blood. The police officers may very well go and then have counseling sessions. They've got the system, but where do I go as an interpreter? I still have to go home and join the family dinner as if nothing has happened. So it's really powerful testimony of what we interpreters are faced with. So for my talk today, what I'm hoping to cover are a few points. First of all, of course, if you have come across or you haven't come across the idea, I'm hoping to share with you the concept of vicarious trauma. And then, of course, I'll share with you the signs of vicarious trauma and what do practitioners in interpreting and translators need to be aware of. In Australia, I've done a couple research studies I'm keen to share with colleagues here. And lastly, if we have time, I'll go into the topic of self-care and resilience building. That's the plan today. So, vicarious trauma. I thought I'll start with the dictionary definitions of these words. And I'll start by the word trauma because it's an easier word in comparison. Trauma, normally, by the word, we have two aspects. On the one hand, it refers to physical injuries, usually caused by violence attack or an incident. On the other hand, we also refer to trauma as something that's emotional. So severe emotional shock or pain caused by extremely upsetting experience. Okay, so the concept of trauma, I think people don't really have any issues to grapple with. But when it comes to the word vicarious, I am ashamed to acknowledge that about 10 years ago, when I first came across the concept, I didn't actually know what vicarious meant. Therefore, to share with you, again, the dictionary definition, vicarious, it's an adjective, yeah? A vicarious feeling is experienced by you watching, listening to, or reading about other people doing something rather than you yourself doing it. So it's kind of secondary, if you like. So if you put the two words together, you kind of get the idea. It's not really the trauma that you yourself experience, rather it's something other people experience, but then somehow you also feel it. So I'll explain. So how was vicarious trauma discovered? It was actually back in the 1980s when researchers started looking into first responders. By that we mean, people like police officers, firefighters, search or rescue personnel, and paramedics. When you look into these professions, you would appreciate that they, in the common way, most of them would routinely be exposed to emotionally challenging and unpredictable situations involving sometimes death or injury. These people often felt overwhelmed and experienced high levels of stress, and therefore they developed traumatic responses similar to the victims they helped. For example, emotional exhaustion, sleeplessness, physical fatigue, fear to safety, or sometimes even intrusive images. And this is when this term secondary traumatization was first raised about these professions, who experienced similar symptoms like the victims they worked with, but they themselves didn't really have the traumatic event. They didn't experience the event themselves. They were there to help those victims. Now, a decade later, in the 1990s, the research target kind of switched to those psychotherapists. And we know that these professionals will routinely treat victims of violence, child abuse, war, genocide, etc., etc. All very traumatic. I think people would appreciate. The way psychotherapists conduct their therapy normally is by engaging with their clients, by listening to their descriptions of their horrific experiences. So over time, these therapists felt changes in the way they felt about themselves, about others, and about the world in general. So the effects researchers found didn't appear to come from just one client. Rather, it was cumulative over time and over many clients. So this is when the term vicarious traumatization was coined to describe the transformation within the therapists themselves as a result of their emotional and empathic engagement with their clients, with their traumatic experiences and the aftermath of such experiences. So this is where it came about. I quite like this lay definition or description, if you want to call it, from the American Counseling Association. So they describe vicarious trauma as the emotional residue from working with clients by listening to them telling their trauma stories. In that way, these therapists witness the pain, the fear, and the terror that trauma survivors they have endured. Okay, so that's the lay definition, if you like. So the term vicarious traumatization, slightly different, it describes the process. Okay, yeah. Of course, today we are talking about vicarious trauma, but I'm sure colleagues might have heard about different terms at different stages, and they all mean different things. So I'm hoping to give everyone a bit of an overview of the terms that you might come across. First of all, you might have heard about the term empathic stress. It is just a natural response resulting from us witnessing someone else going through a stressful situation. For example, if on the road you see a dog being kicked, you see someone falls over and injured, you feel empathetic for the person, you feel a bit of stress. That's your empathic stress. A bit along the spectrum, again, I think people have all heard about the concept burnout. When you feel burnout, it is a sense of prolonged physical or sometimes psychological exhaustion relating to your work. So important to understand that burnout normally it relates to work, but it does not need to include traumatic elements. At your workplace, if your colleagues or your supervisors are not supportive for you to perform your job well, you feel burnout. So it doesn't need to include, or it doesn't need to have that traumatic element in it. The next concept people might have heard about is this compassion fatigue. It specifically relates to a lot of professions. If you undertake your work, you need a lot of compassion. Your nurses, teachers, doctors, all these lines of profession, you need a lot of compassion. But when you suffer from compassion fatigue, it means that you are emotionally or physically exhausted to the point that you run out of your compassion that's needed for your job. And next thing, we talked about it at the beginning, where vicarious trauma was first coined. Before then, a decade before, it really was that researchers looked into secondary trauma relating to those first responders experiencing very similar responses from those victim survivors. So that's the term. But of course, today we'll focus on kind of the more severe end of the spectrum, if you like. By that, we mean vicarious trauma. Oh, and I forgot to mention that vicarious trauma in the field, you might see people refer to it in its short form, VT. Okay, so in terms of VT, there are three important elements that we have to bear in mind. First of all, it refers to the repeated exposure to other people's trauma. So it's not one-off, if you like, it's repeated. Second element of vicarious trauma is that, it's cumulative. It builds over time. Again, it's not like at one point in time. It really is kind of, it goes along the way. And the third element is that people who suffer from vicarious trauma, they really feel some significant changes in themselves, in the way they see the world. In other words, their belief system somehow has been changed as a result of hearing other people's traumatic stories. So of course, I think now that we have a bit of a concept about VT, let's look at the signs of vicarious trauma, what we have to pay attention to basically. In essence, it would manifest in many aspects, if you like. Physiologically, you might feel something. Emotionally, behaviorally, you might behave in a different way. Cognitively, and lastly, at work, you might do something slightly different. In terms of your physiological responses, we are looking at you feel much more, fatigued. You might have trouble sleeping. You might overeat, or you lose your appetite. Or sometimes people develop headaches or rashes or ulcers, etc. Now, emotionally, people report that they feel free-floating irritation, very easily irritated. They feel somehow a lot of anger or jumpiness in their emotions. They might have difficulties talking about their feelings or being close to others that they used to be close with. They might have lasting feelings of grief, anxiety, or sadness, and they don't feel joy in the things that they used to feel really happy in doing. or they have dissatisfaction with their own lives and feelings of hopelessness. Okay, so these are the emotional responses you might find in people who suffer from vicarious trauma. Behaviorally, you might find people socially withdraw from their community and their family. They might increase the use of alcohol or substance. This actually manifests in our research data. So that second point there is really a valid point. They might engage in risky behavior that they never were used to, and they might avoid people or tasks at some time. Cognitively, people might dream about their clients and their clients' situations. Again, this also comes out in our research data from interpreters and translators. Or they might have persistent intrusive thoughts, concerns about their safety or their family members' safety. They might develop cynicism and negativity in the way they see the world. And they might have difficulties in concentrating, remembering, so on and so forth. And lastly, in terms of their work, people who suffer from vicarious trauma might have lack of motivation for work, whereas the person used to be really, really enthusiastic. They might become tardy, or they might, from time to time, they might skip work, they don't show up, they might be late, or on the other hand, they might overwork, trying to forget about it. They feel dissatisfied about their work, and lastly, they might find it difficult to separate work from their private life. So these are the signs that we really have to pay attention to when it comes to vicarious trauma. And of course, the reason why we need to pay attention to is that vicarious trauma really impacts us. It might create profound changes in our belief system. We mentioned that before. And their functioning is also impacted. So on the personal front, it may affect your emotional and physical well-being, and it changes your relationship with your family members and your friends. And on the work front, professionally, it may affect your performance and your functioning and result in errors in judgment and mistakes. And that's why we need to pay attention to. Now, I might ask colleagues whether you can guess, as of now, which professions have featured in the vicarious trauma literature over the last few decades since it was identified. Have a think. And of course, I'm going to tell you the answers. All right, let me share with you. First of all, I think I kind of mentioned it before, firefighters, these so-called first responders, ambulance workers, and those helping professions such as nurses have featured very strongly in the VT literature. Therapists, psychotherapists, social workers, let's not forget, law enforcement, judges. Imagine judges having to listen to horrific cases day in, day out. Actors, you might be surprised to hear, but later on I have a slide I'll share. Actors, they have to portray traumatic scenes and traumatic events. They might also suffer from vicarious trauma, and of course, interpreters and translators. So my message here really is that if witnessing clients' trauma can have such impact on all those other professions we just saw, there is absolutely no reason to assume that an interpreter would be immune to the same experience if we work in exactly the same setting as your doctors, nurses, psychotherapists. These are the settings that we work with, and therefore there's no reason that we will be immune to the same experience. Now, a lot of people refer to VT as an occupational hazard or regard it as some sort of cost that you have to pay for your work. so cost of caring, or it's a career-related cost. For many other professions, such as your social workers, nurses, counselors, psychotherapists, at least in Australia, these professions have their formal supervision. In other words, periodically, normally it's once a month, as far as I understand, they will go to their superior or a senior practitioner to get their debrief regularly. But then for interpreters and translators, not really, we don't. We do not have these ready avenues for us to do the same. So this increases distress in some colleagues. Therefore, it is really important that you are aware of this concept of vicarious trauma and you take active measures to protect yourself against it. That's really, really important. And of course, I've kind of scared you about this concept. On the other hand, I also want to say that, look, we really have to be alert, but we don't want you to be alarmed either. Why? Because not everyone who works with traumatized clients would develop vicarious trauma. If you look at overall, the incident rate is actually quite low. So that's it's a comfort, I suppose. While many helping professions have reported signs or symptoms of vicarious trauma, but overall, I think professionals, they've got this innate ability to try to figure out what they have to do and deal with it personally, and therefore their functioning has not shown to be significantly affected. We also have to bear in mind that vicarious trauma, at the end of the day, it's not only the work that you are exposed to, you also have to take into account your own trauma history, your own mental issues, if you have any, and also, your personal issues in life that might be troubling you, and therefore they kind of compound the situation that you are in. So the key really is that awareness is the key. Please watch out for the signs and reach out for help if you feel that you are starting to experience those symptoms that I covered. So I really love this quote from a couple Australian sign language academics. They say that an ounce of prevention is worth a pound of cure. I'm hoping that it resonates with you. Now, let me come to a couple of research studies that we've done in Australia to share with you the landscape back home. Back in 2015, my colleagues and I conducted the largest survey so far in Australia on interpreters and translators. We actually involved both. There were 271 respondents who very kindly took part in our survey, and nearly 80% of those who responded to the survey told us that, look, in their work, they were actually affected by the traumatic content that they encountered at work. And among these practitioners, 70% of them reported that they did not seek any psychological assistance. These practitioners, when they felt emotionally disturbed by the traumatic content, who did they speak to? They actually went to their colleagues. Over half of the practitioners went to their colleagues to talk about it. And 46% of practitioners said that they confided in their family members, and 38% of them said that they spoke to their friends. Only a very small number of them sought professional assistance. 20% went to a counselor, and 14% went to a therapist. And eventually, 40% of those respondents said that they would, in the future, if they knew that this interpreting assignment is going to be involved in some sort of traumatic content, they would say, no, sorry, I'm not going. Which is not a very good thing, because some languages in Australia, we don't have a lot of interpreters. So if, 40% of them say that, no, I'm not going to interpret, it actually has a huge impact on the workforce. So that was back in 2015. And then a few years later, myself and Susie Costello, who is a social work professor, we then conducted a qualitative study by conducting a few focus groups, trying to understand in detail how practitioners felt about this topic. So these are the things that we found. Interpreters told us that sometimes they were really reluctant to share their emotional vulnerability. Why? Because in their culture, if they divulge that, oh, I'm affected by the things that I interpreted today or last week, in their culture, you might be regarded as weak. They might say, wow, Miranda is not a very good interpreter. She is easily emotionally disturbed. So interpreters, they were reluctant to share that. That's what we found in our data. And they also share with us that empathy with their client, particularly the non-English speaking client that they worked for, really has psychological impacts on them. And they brought the idea, they kind of pinpoint the idea that, look, when I interpret, I have to use the first person. I was beaten, I was hurt, and cumulatively that really affected me. So that's what they told us. I also really love this quote from this British researcher who says this: interpreters became their client that they interpret for, using their tone, using their body language and their words, therefore losing themselves in the interaction. So I think that really captures what we do really well. Interpreters that we spoke to rejected the idea that they were just merely machines, conveying whatever people said. They really wanted to be part of the service delivery team as an equal partner. That really came out very strongly. And also in our data, we found very clearly that a lot of practitioners misunderstood the meaning of one of our code. Really important thing that we need to keep confidentiality, but they had misunderstandings. I'll go into this very important point in the next slide or the following one. And lastly, we found that to support practitioners, we need this kind of golden triangle, if you like, from three different parties. First of all, those people that we interpret for, those English-speaking professionals, your doctors, your lawyers, your police officers, your judges, so on and so forth. Interpreters really want to be regarded as a team member that these professionals work with. They do not want to be regarded as, we are using interpreters. Therefore, it's kind of very utilitarian concept that using interpreting just as you will in a translation machine and then discard it when you are done. They don't like it. So they really want the professionals that they work with regard them as a team member that they work with. Second pillar, if you like, is the educators and those professional bodies. They need to provide targeted professional development. Back in the days when I studied interpreting and translating, that would be like 20 years ago, there was no concept about, paying attention to vicarious trauma when we studied interpreting and translating. But then these days, now that we know what we know, educators, we really have to put this concept in our curriculum, and professional bodies, and I'm sure there are quite a few here in Spain, should have been exactly what we are doing here, would have professional development to educate practitioners about the risks and also the measures to counter that. And lastly, employers who employ interpreters and translators, they really have the responsibility to look after their workers. And here I'd like to share this service back home. My understanding is that overseas, this is probably not available yet, but I really want to explain something about this employee assistance program, which is now available to a lot of interpreters and translators in Australia. When we conducted the first study back in 2015, there were really very, very small number of interpreting employers who provided this employee assistance program back then. Okay, very small number, you can count, fingers, 5 fingers, no, even less than, fewer than that. But these days, most major interpreting agencies have this particular program. So you might ask, Miranda, what is it? This Employee Assistance Program, or in short, EAP, in Australia, means that it is independent and external counseling service provided by these interpreting agencies. They include debriefing and welfare support services to the employees, very importantly, free of charge. So as an interpreter, you are entitled to use these services provided by the company that engages you to go to those interpreting jobs. These EAP programs, if you access the program, they cannot tell the company that employs you that Miranda accessed the service. They cannot tell the company. In that way, you get protected. Yeah, you can use the service, but the company doesn't know that you access the counseling and the support there. It kind of keeps your confidentiality so that you feel at ease. You wouldn't be scared that, oh, if I use it too much and my company will say, blah. Miranda is not a very good interpreter. She is easily affected by whatever the interpreting assignments that she goes to. The company pays for the service, but like I said, they wouldn't know who accessed it. So that's very important. So like I say, this light at the end of the tunnel really is emerging, at least in Australia, that after a few years of advocacy of the well-being support for practitioners, most major interpreting agencies these days provide EAP for the practitioners back home. So what Australian interpreters say would help them, if I could kind of summarize it in the next few points from our studies, this is what they say would help them. Briefing is very important. Tell me what the assignment is about. Extremely important, so that I can psychologically, emotionally, and cognitively prepare for my assignment. Treat me as part of the team. That came out really strongly, like I mentioned before. And importantly, debrief me. Okay, ask me if I'm okay after this very traumatic session of interpreting. And I mentioned that before, and we really want to see this joint effort by this golden triangle. Yeah, those professionals who engage interpreters, we want them to come on board, treat me as part of the team. We also want educators and professional organizations to play their part in sharing their awareness, educating future practitioners or practicing interpreters and translators about the concept and self-care. And lastly, employers of interpreters and translators, they need to provide support as well. So this is the golden triangle. And of course, when you have the concept, you also need to undertake things to help yourself, care for yourself, and build your resilience. So that's important. All right, so my message here really is that if you feel the impact of the interpreting assignments that you've undertaken, please reach out. And in my sharing of our study before, I mentioned that people misunderstood confidentiality quite a bit. Therefore, I want to address that point. Practitioners rightly ask the question, can I talk to people about the distress I feel from my interpreting assignments? What do colleagues think? Can I not? I'm supposed to keep confidentiality, even if I feel stressed or really traumatized or really affected by the content. Can I talk about it? What do people think? I'd like to kind of rectify this misconception if I could. Interpreters, if you think about it, we've been told, and which is true, that we must behave impartially because we need to be neutral. I can't help any party more than the other one, which is true. We must behave impartially. But I asked the question, could we also feel inside impartial? No, I don't think that's a tenable proposition. We absolutely can behave impartially, but we cannot feel inside impartially. You might feel really feel for the person that you interpret for, who has been through a lot, who has been, who has really traumatic stories to tell. So you can't help feeling for them. Your feeling inside is your feeling, okay? It is impossible. It's untenable that you feel impartial. So it's not possible, is my take of it. Therefore, should you not talk about it? Absolutely not. You should talk about it. So who can you talk to? You can talk to your colleagues who, I suppose, would have a sympathetic ear. Colleagues and your peers you can talk to. You can talk to your professional groups, your personal networks, family members, friends, or you might have some community resources. If you are more religious, you might go to your places of prayer, or you might seek more formal assistance from counselors and therapists. And of course, I know that you have this doubt. Can I really talk to them? Yes, absolutely you can talk to them. But the question is, what should you be talking about? That's the question. Now, you should be talking about how you feel, your thoughts, but not talking about, I interpreted for this case today, and the story is like this person did this person experienced that. No. Therefore, I would really want to encourage colleagues here that absolutely you can share your thoughts, your feelings, and your emotions with all the people that you see on the screen, but you just need to be mindful of what you talk about. Focus on yourself, your thoughts, your emotions. There is absolutely nothing wrong that you go and then seek psychological and emotional support from all these people. So coming to my last few slides, I want to address the topics about self-care versus resilience building, and I'll start by self-care. If you look through the literature, there is no consensus in the literature for a single conceptualization of self-care. Some describe self-care as a process, others describe self-care as an ability. But the general thread in the literature is that self-care refers to engagement in particular behaviors that may promote a sense of subjective well-being, a wealthy lifestyle, stress relief, and building of resilience, and the prevention of compassion fatigue. And when we talk about self-care, we can also divide it into personal self-care and professional self-care. So in here, self-care, I quite like this self-care wheel you see on the screen, because it kind of divides what we can do in a few different aspects that you can pursue. So say, for example, perhaps we start from physical self-care. colleagues would agree that, we should exercise and we should get enough sleep, we should eat well, eat healthily, and we should go for a walk when we need it. So a lot of things that you can do to look after your physical well-being. Personal well-being, by that we mean we should try to figure out what you want in your life. You might want to think about your short and your long-term goals in your life, in your career, and you develop friendships, so on and so forth, to look after your personal well-being. Next one, your mental self-care. What can you do? Self-reflection, a good thing. Gardening might help you to reflect better. For some people, I don't really have a green finger. Anything I touch in my garden, they will die, so I'll skip this one. Mindfulness, if you want to practice it, or some colleagues might want to engage in journaling to write down, your reflections, what you experience, and then think about, the measures that you can take in terms of the whole self-care issue. If emotional self-care, you might want to laugh out loud, you might want to cry, you might want to practice self-love, practice forgiveness, so on and so forth. There are a few things you can do. If you are more inclined to spiritual side of things, you might want to go for more religious side of self-care, meditate, yoga, so on and so forth. And lastly, professional self-care. You might want to talk to your colleagues, you might want to set boundaries to delineate this is work, this is my private life, and really cut it really clearly in what you do. You don't work overtime, you set yourself a rule to really pursue that, and you learn to say no. I think that's very important. And then you engage in professional development. Okay, so in this self-care wheel, we are looking at quite a number of different things in different areas. I think it just kind of promotes the idea of thinking about the things you can do for yourself. All right, now, I want to share this because I think it might resonate with you. Now, what you see on the screen this is quite an old film, I think from 2008 or thereabout, from the Batman series, The Dark Knight. This film, I don't know whether colleagues here have seen it, but this gentleman here by the name of Heath Ledger, he's an Australian, a really brilliant actor. He plays the Joker in this film. Really, really outstanding performance. And because of his performance, he actually received the Oscar nomination. Eventually, he was given the Best Supporting Actor for that year's Oscar award. However, posthumously, meaning that he had passed away before he received the award. Why? Because he had a drug overdose during just the filming was finishing, I think. Therefore, unfortunately, he passed away. Why did the episode happen? Because he had trouble getting out of the role, the Joker role that he was playing. That was the point. Therefore, I'd like to share with you this concept of de-rolement technique, which comes from the performing arts, to tackle this emotional lingering that actors and actresses feel. Because we can appreciate that, look, actors and actresses, a lot of times they have to play roles representing human suffering, distress, violence, and some are actually susceptible to vicarious trauma. Interpreters, if you think about it, we must process client material by imagining the client's perspective, kind of in a way similar to actors, if you like. we must use the first person I in our interpreting. Therefore, it's not the same as just hearing the words. We actually have to cognitively process the story that we hear from our client, and then we can perform. So it's not the same as just hearing the words. So in a sense, what we perform in our interpretation is kind of, in my view, is kind of similar to actors, apart from that we are not actually acting, but in a way we are acting using our voice and our interpretation. So in the performing arts field, they have these techniques they have a lot of techniques to help them get in the role to perform well. But when they finish performing, they also have techniques to get out of the role. Very, very important, so that you are not like this Heath Ledger there, who kind of suffered from not being able to get out of that portrayal that he was he had to do in his acting. So the techniques in the performing arts, they had this thing. They say that, look, you can try shake your limbs or your body to literally shake the character off. You shake it off by moving your limbs or your body. Or they can ritualistically step out of their performance by handing back their costume or the prop to the director by saying, look, okay, my costume today, give it back to the director. Finish work today, I'm going back to my private life and be myself. So these techniques from the performing arts, it might give us some sort of inspiration in terms of what we can do. So this de-enrollment, these techniques may also be useful for interpreters. In our data, our practitioners shared with us that a lot of them actually did this. Once, when I finish my days of interpreting, when I go home, I change my clothes to my home attire, my home clothing, comfortable and all that. So I demarcate my work and my private life. So it's something along these lines. So I think I'm just hoping I can give you some inspiration from the actors and actresses and what they do to help us to think about that we go in a role in our interpreting work, but it's also important for us to get out of the role and go back to our private life, and we need to be able to do that. And once we've talked about self-care, and I want to just very quickly address the concept of resilience. Again, there is no consensus in the literature for a single conceptualization of what resilience is. But the general consensus points to the fact that resilience is a process which may involve multiple or sometimes unexpected pathways. People do different things to achieve resilience. And it may take time, which is characterized by a contemporary decrease in your functioning, followed by a stable trajectory toward recovery and an ability to adapt and move forward in a positive and integrated way. Okay, so it's kind of a process where you feel emotionally affected, you feel down, you feel you don't know what to do, but then this is a process. If you consciously let yourself be in this mode of building your resilience, then you will feel this trajectory towards recovery, right? It's a process of successfully adapting to difficult or challenging life experiences, especially through your mental, emotional, and behavioral flexibility and adjustment to external and internal demands. The construct of resilience covers all these things. It covers self-esteem, purpose in life, life satisfaction, social support, cognitive flexibility, and proactive coping. And when we talk about resilience, maintaining it requires conscious effort. It doesn't come automatically. You really have to consciously try to develop your resilience by many different self-care activities that hopefully you engage in. This way you can avoid burnout from work. You don't risk losing your compassion, and you don't develop vicarious trauma. So important. Self-care strategies may result in developing your resilience at the personal level as well as at the professional level. It really is a process of adapting well in the face of adversity, trauma, tragedy, threats, or significant source of stress. And lastly, resilience enables a person to bounce back after a traumatic experience with adaptability and creativity, and it is strengthened by the development of adaptive coping skills. So all in all, it is kind of a conscious process that you have to engage yourself in. And it is absolutely needed for a stressful profession. Now, my last few messages here. Your well-being really matters. So staying healthy takes intentional effort. It doesn't come automatically, unfortunately. We need to address that elephant in the room. And of course, in this case, I'm referring to vicarious trauma. So we really have to be conscious of taking active measures in order to look after ourselves. And my message is that if you, particularly for students who are studying to become an interpreter, you will, I use the word, you will be exposed to distressing material. It's not a matter of whether, it's not a matter of if, it's a matter of when. So you will be exposed to distressing material. Therefore, awareness of vicarious trauma is very important. If it impacts you, seek assistance early. There's nothing wrong seeking assistance. Seeking help is actually a skill and an attitude, okay? So that's what I want to say. And I love this quote. I always share this quote. And again, I'm hoping that it resonates with you. It goes like this. The expectation that we can be immersed in suffering and loss daily, like what we do as interpreters and translators, and not be touched by it, it's as unrealistic as expecting us to walk through water without getting wet, right? So I'm hoping it resonates with you. I've come to my last slide here. And every time when I talk about vicarious trauma, of course, you know, I talked about being aware of it and the negative impacts on you, therefore you need to take measures and all that. But I really want to end with a positive note. Now, in research, of course, I mentioned that vicarious trauma was coined, 30 years ago? But in recent years, since the 2000s, there has been these new research studies come on, letting us know that, look, as opposed to vicarious trauma, these days, we found, researchers have found that there is also this concept about vicarious growth. So what do we mean by that? Look, if you vicariously experience the traumas that your clients experience, you will also be able to, or it is also possible for you to vicariously experience the growth from your client, in the sense that a lot of times, particularly in the psychotherapeutic settings, the therapist will work with the trauma client throughout many sessions, and they would actually witness the client from a really vulnerable position, really troubled, and through the therapy, the person actually slowly overcomes the trauma, the hurt, and the impacts, and then the person actually gains growth. So you can imagine the therapist witnessing the growth in the client. They earlier on experienced the trauma vicariously, but in this situation, witnessing the growth in their client, they can actually also experience the growth, the happiness vicariously through their client. Of course, I totally appreciate that in the case of interpreters, more interpreters, probably not translators. In the case of interpreters, in most situations, we go in an interpreting setting in a really kind of haphazard way, in the sense that today I interpret for this client, the next session, the client might get a different interpreter. So we do not really have the continuity or the privilege, or the system is not geared up for us to be working with the same trauma client continuously. Therefore, in our case, it might be a little bit more difficult in witnessing this growth in the client. If you don't interpret for the same person kind of continuously, it might be a little bit difficult. But I still want to share with you this concept of vicarious growth, just so that we are aware that, look, it is possible, particularly if we are lucky enough to be able to work with the same client and then witness the person overcoming the adversity in their life, and at the end they see light at the end of the tunnel. We can also experience that vicariously. So I'm hoping that this positive note will give people some comfort in the very important work that we do. So by that, I finished my talk today. Thank you so much for listening to me.
You have some more time from the colleague.
Thank you so much.
Thank you very much for this inspiring lecture. If anyone online or here wants to pose any questions, you can, online you can type it in the chat box, or you can just open your microphones, or you can take the floor. And while you're preparing your questions, I will, there's already one. I just wanted to mention briefly that, so this is such important research, debunking the damaging collective illusions that pushes back as a profession, because you mentioned growth, and it's important to face these issues in order to grow individually as people, but also collectively as a profession, and also as a discipline as well, not to hide that elephant, but to acknowledge the elephant in the room. So I thank you so much, because you're making us grow as both individuals, but also professionals. Thank you very much. So now we have two people waiting for their to pose the questions. Maria Branda from Universitat Jaume I, can you please take the floor?
I don't know if you can hear me.
Yes, thank you.
Yes, it's working. So more than a question is a huge thank you for this, because I've been, myself wondering how to deal with these issues in the classroom at the University of Salamanca. It's not that it's not just that I really enjoyed your presentation, but I have to say thanks, because it also applies to academia, and it applies not just to interpreting and to teaching interpreting. The fact, there was one thing that really resonated with me when you said how important it is to be empathetic, and how sometimes it is viewed as a weakness. And I've been wondering for many years now how we can convey to students of interpreting that this empathy is not a weakness, but a virtue, and that it has to be managed and used as an asset through self-care, as you said, and through derollment, as you said. And what I want to thank you for specifically is that you gave ideas. You said how. And when I say that it applies to academia, it also applies, for example, to, being a trade unionist, which I am. You get these huge negotiations where lots of things are at stake. These mental health issues are very important in the sense that you have to afterwards be able to get out of your role, not just when you're interpreting, but when you're negotiating, when you're doing certain jobs in academia, as you might know. And I want to share what I do. I like watching a gripping movie or a series to get out of that role specifically. And, I have some movies that work better than others, and I'm pretty sure that you can think of your own movies or series that make you come out of the role that you've been immersed in for the whole day. Thank you very much for that, Miranda.
Well, thank you so much.
That was really nice. The treat. Thank you very much for sharing. Gaia Betsy, do you want to open your microphone? Gaia Betsy, open.
Sorry, can you hear me?
Yes.
We can hear you.
I cannot hear anybody anymore. Do you hear me?
Yes, we can.
Oh my God, sorry.
Yes, we can hear you. If there are other questions, we can wait until Gaia sorts out her issues with the technology. Are there any other questions or tricks you want to share? Maybe from the floor.
Yes.
Kim Schulte wants to.
Yes, just I thought it was really interesting in your qualitative study that interpreters rejected or disliked the term to be used. I dislike that very much as well. It sounds respectless to me to use an interpreter. You don't really use professionals. But I think that could probably be extended to another term, word that you actually used all the time, client. I don't think client is the best word actually for the person we interpret. Or we could call them perhaps interpretee, because think of a doctor. A doctor doesn't have clients, they have patients. And the same, I think, would change the relationship, how we see our relationship, how we perceive our relationship, and how our relationship is perceived by outside people if we say we interpret for an interpretee, for lack of a better word, rather than a client, because client really implies this kind of a business relationship, no more and no less than just business. The person who pays you is your client for some service. And I think what interpreters do is provide more than just a service, just a simple service, a business service. And I think that's something we could perhaps add to this idea of how to, well, just, for interpreters to perceive themselves and to understand that they're doing more than just providing plain basic service or something like that. So I think that's
the point. It reminds me of sometimes at universities, and I'm sure colleagues here, if you are an academic, sometimes we kind of jokingly say that our students are our customers.
Yeah.
They pay money.
Exactly, yes.
So yes,
it's the same idea, really, yes.
Yeah.
Students aren't clients either.
Yeah.
If you think about it.
I get your point. Yeah. Perhaps there is a point to.
We could try to establish some kind of
Yes.
common term we could use rather than client.
Oh, thank you so much.
Think.
Interpretee is a nice word.
Yeah, you can use that.
Yeah.
Works perfectly. And often your interpretee isn't the person who's paying you, in fact, so it's more precise. It's not the same person.
Yeah. Thank you very much. Gaia, do you want to take the floor now?
Yes, sorry. Now you can still hear me, right?
Yes.
Okay, sorry, I couldn't hear you anymore. Anyway, thank you so much for today's presentation. It was really insightful and complete, like starting from the definition to vicarious trauma to also the difference between self-care and resilience and suggestions on how to solve these problems. Like, thank you, it was really insightful. Now my question now is more like terminological. I want to ask, how did you come out with that like the differentiation between the different terms like vicarious trauma, secondary traumatization, burnout? Because like I myself did some research on that, because I was also interested in vicarious trauma for my research, but I found that these terms tended to be used interchangeably, and so I tried to go back to the original definitions of these terms. And although I can feel that vicarious trauma was always a little bit per se, because it involved, as you mentioned, inner changes, an inner transformation in the listener, the therapist. The other terms tended to overlap. Also, they were developed in the same time. Sometimes the origin, like the definitions by the authors, were mixed in the different authors worked, collaborated to, same volumes using different terms. So and I feel that right now, like, they're still used pretty much interchangeably in the literature. So I was wondering, is this your interpretation of how these terms differentiate, or like is it some kind of evolution in the literature that I am like starting to differentiate these terms?
Yeah, I think I want to recruit you into the research team. So much for bringing this up. You've got it absolutely right that if you look around, particularly online these days, not only academics, you've got all sorts of people talking about all these things, and everybody, like you say, if it's not strictly academic, people tend to use particularly secondary trauma, vicarious trauma, or sometimes even compassion fatigue. These are slightly different, but then people use it interchangeably. That's why I kind of went and then looked for more academic definitions and try to clear it in my mind, different terms, and sometimes you get different definitions as well. So it's really, really confusing. I got it to a point that I was able to make sense of all these different terms, but I do acknowledge, absolutely, like you said, if you go online or even, anyway, online, it's hugely confusing, but people tend to use various terms interchangeably, and even you might find definitions, inconsistent definitions all over the place. So it's really confusing. I suppose from research point of view, it would be helpful that we kind of go by only academic sources and then keep the noises out, because there are so many things on this related topic out there. And rightly so, for many helping professions, people do need to deal with this issue. It's just that it gets so muddled that it's very hard. I think the horse is bolted in a sense that all these different terms are just everywhere, and people kind of understand the terms differently and then in a very confusing way. So it's a bit unfortunate in that sense. But at least I suppose this is why I think we should be clear about the definition of vicarious trauma. I think that's important. And then burnout is also a relevant concept for our profession, for any profession. Burnout, it can happen in any profession. So these two concepts, I think we should be very clear about. All the other noises, when we come across them, we just need to be aware, and then we kind of have to chip away in our own understanding that, look, different terms, people kind of define it differently. But at the end of the day, when we do research, I kind of go by the academic definitions from the relevant literature. That's the best we can do, I suppose. But thanks so much for your question.
No, thank you.
Thank you, Gaia. Sarah Polidor, do you want to open your mic and play your book?
Hello, thank you. First of all, thank you for this amazing presentation. And I'd also like to thank you for your work, because I just finished my PhD on the impact on traumatic materials to interpreters who assisted Ukrainian refugees. So I dealt with vicarious trauma and post-traumatic vicarious growth, also thanks to your work, because I was really inspired on your works that you did in the past. And so thank you. And about my questions, I'd like to ask you, what do you think about interpreters being defined as helpers? Do you think they really can be included into those helping professionals category? And also, do you think it is okay to expose interpreting students to traumatic material during classes?
Thank you so much, Sarah, for your question. Interpreters being regarded as one of those helping professions, I'm less certain about it. We work with all those helping professions. Yes, indeed. But then I suppose my code of ethics is now at play, in the sense that we are educated, with our code of ethics, that we are not there to help anybody, really. We are there to facilitate the communication for the helping profession. Therefore, I have to think about it, but my first thought is that I probably wouldn't consider ourselves in one of those helping professions, because we are not doing the job. Those professions, your doctors, nurses, first responders, and all that, teachers is also one of those helping professions. We're not really there to help our clients, for lack of a better word. But our job is there to facilitate the communication. Therefore, I have a bit of reservations. And then your second question was about, now I forget. Your second question was about, could you remind me?
Yes, of course, thank you. Like exposing students to traumatic material, like interpreting students, of course. Yeah, like
that I don't have reservations about. Of course, I mean, being an educator, being an instructor, you have to choose the material carefully and give students notice about it. They can very well excuse themselves if, if this particular session that you plan, you want to kind of delve into a more traumatic interpreting simulation session, give them notice, give them context, and allow people to excuse themselves. I think that's probably the best way to tackle it, because at the end of the day, if you are not doing it here in a safe and nurturing educational setting, they are going there to be confronted with the real thing. So yeah, by all means, just you need to have the supporting mechanisms there to be available, just so that, and also debriefing will also be very, very important. When you've done that, and then have a debriefing session, that would be best.
I think actually that would be very, very useful in terms of learning, so for students, for future professionals, to learn how to identify their own felons.
Exactly. Right? Yes, absolutely. I look forward to reading your PhD.
Oh, thank you.
And now Anthony Pink has raised his hand.
Okay. Hi, Miranda. Many thanks for the talk. I missed the beginning, Miranda.
Oh, did you?
Did you mention that you're here on an Erasmus exchange?
I did.
Very good. Because we're really happy to lend you to Esther. Okay.
That's right. Yes, I'm on loan here.
Okay. My question is you mentioned that interpreters have to use the first person. Now, in data from court interpreting in Barcelona, and this is Judy Traigal, who's online now, she went through that data and found that that's not always true. It's not a universal norm. There are many cases where interpreters actually use third person, at least in that respect. And I'm wondering if that is a psychological barrier to a bit of trauma. Could we question the ethics-supported norm of using the first person, perhaps?
Yeah. Well, thanks so much, Anthony, for the question. I suppose using the first person, not universally the rule, yes, but then it is regarded as best practice, if I could put it that way, just so that people who receive the interpretation is not confused. That's one point that I'd like to address. But of course, there are situations using first person is not conducive to communication. At the end of the day, whatever you do really is that you are trying to make the communication happen as best as you can. For example, phone interpreting, you can't see who is who, and you say I through your interpretation, it wouldn't work. Therefore, in phone interpreting, sometimes people might switch to the third person in their interpretation, or if you have a multi-party conference, for example, it might be a family. Might be a patient, family members having a conference with the treating clinician. People are all talking to each other, and you say, if you stick with, first person, it wouldn't work because there are so many parties who are talking. So yes, indeed, I think you are right in the sense that it's not universal. Even people who think first person is the rule, there are situations where we can't use first person. Okay, so that's that. And I do agree with you that yes, from the literature where researchers say that using the first person, it does impact on interpreters in the sense that it's more cognitive processing in us, trying to understand the story, trying to empathize with whatever the person is saying, and then you give it out. Therefore, that impacts you more, I suppose, when compared to using the third person. You kind of create a little bit of distance, I suppose, again, cognitively, in order to, using the third person creates a bit of distance. Yes, I agree with that. But I suppose coming back to your question, are you suggesting that because I know this is a traumatic setting, therefore, in order to protect myself as an interpreting professional, let me switch to third person? Are you referring to that?
No, not at all. I was just interested, particularly in Melbourne, thanks to COVID, we had a lot of community-based translation and interpreting, non-professional, not using the first person. It seemed spontaneous to many people not to do so.
True.
And that this would be an interesting thing to do research on.
Oh, okay. Yeah. Yes, that's a very good idea. In other words, using first person as opposed to intentionally using the third person, and then see the impact on the, okay, yes, there you go.
Okay.
The next PhD recruit.
For your next PhD.
Yes. Thanks so much, Anthony.
Okay.
Thank you. Are there any other questions? Yes, first. Tajiji.
Yes, Tajie.
Can you hear me?
Yes.
Yes, thank you so much, Professor Lai. My greeting from Chengdu. I am so I'm so impressed by your lecture. My first question is, as you mentioned, vicarious trauma has a very strong connection with empathy of interpreters. But on the other hand, we know that in interpreting, interpreters are always required to be empathic listening with their clients, right? So I don't know how interpreters should balance their empathy during the interpreting tasks, because if they are um, involved strongly, maybe they will get the risk being vicariously traumatized. But but uh, but on the opposite side, their clients may say your interpreting service is maybe something like a machine or robots interpreting. And my second question is, we know that in conference interpreting, interpreters are always asked to provide interpreting in the first person. But it seems common sense that people and the scholars would apply as norm in both conference and community interpreting settings. So, do you think interpreting researchers should divide that's normal into different settings? Like interpreters can select the different the stanzas in different settings. Like in conference interpreting, they may use the first person interpreting, and in traumatized environmental interpreting, maybe they have the right to do it in third person interpreting. Thank you so much.
Thanks so much, Tao Jie. Your second question was very similar to Anthony's. So, see, great minds think alike. Yes, indeed. Anthony was also suggesting that perhaps there is room for us to conduct research in relation to more traumatic interpreting settings, whether, and of course, I think in order for us to provide any evidence-based recommendations, you need research. Therefore, let's do research on traumatic settings for interpreters to go in, doing, first person, using first person as opposed to third person, to see whether the impacts, emotional impacts, whether there are any different or similar or none or whatever. So yes, let's do research on that. There is so far nothing of that sort. So something to be considered in the future. Your first question was about the nature of our interpreting work requires us to be empathetic. And we are naturally, people who do this line of work are kind of more naturally empathic people. We have very, we relate to people. That's why we love this line of work. But of course, yes, indeed, on the other hand, you are emotionally invested in whatever you are interpreting for. But on the other hand, you might also be emotionally affected by what you interpret for. I am hesitant to give the advice because sometimes you hear people giving the suggestion that, you look after yourself, you pull out of assignments. Yes, indeed, of course, that is a thing you can do. If you know that this assignment involves something that you definitely, are against, or you definitely cannot bear, of course, don't do it. But I also appreciate that a lot of our practitioners back home here, not quite sure, people's employment is a little bit precarious. People go from assignment to assignment, and if an assignment is coming my way, it's very hard for people to say, oh, no to this, no to that, and at the end, what do? Don't do anything. I think a better strategy would be that, yes, you equip yourself with the understanding of vicarious trauma. You have a set of strategies to counter the effects. You have practiced self-care, and then you consciously develop your resilience. That would kind of wrap you in a good position that you go out in all sorts of different interpreting settings and you protect yourself from the possible, effects or even harm. Perhaps that is a better strategy, I would say. But of course, for certain situations, certain cases that you absolutely know that it's kind of beyond your boundary, then of course, just don't do it. That's absolutely understandable. But I suppose my point is that, and the very point of the session really is to share the concept of the idea and then also encourage colleagues to develop your own repertoire of self-care and developing your resilience. I think that's the my main message.
Thank you very much. I'm afraid we're running out of time. We have the room until 11:30.
Yes.
Thank you very much, Miranda. Thank you very much, audience, everyone in the audience and everyone here in the room for your participation. And well, let's meet for another session
Thank you.
quite soon. Bye.
Thank you so much. Bye, everyone.